Hi, I am Dr. Kunjumoidin, Senior Consultant, Birla Fertility, Calicut and Perithalmanna. So today we are just discussing about something like a low sperm count. Is parenthood still possible? So can you become a father even if the sperm count is very low? Yes, it should be possible with the modern technology. It is one of the most common reason for the male infertility. Male infertility almost contributes 40% of all infertile couples. But here is the truth. Low sperm count, that is very low sperm count or zero count, then doesn't mean that you cannot become a father. You still, with the treatment, proper treatment, lifestyle changes, still we can make pregnancy for you. And most important part of this is the proper lifestyle. As a fertility specialist for the past 28 years, I meet couples with a lot of male infertility in India and abroad. So first we'll see what is the normal sperm count. Normal sperm count is something around 15 million sperms per every ml of semen. That means at least 15 million sperms should be there. Of that, at least 32% should be motile, actively motile, because sperm has to move from vagina through uterus through fallopian tube to reach the ovaries. Okay, and the most important third point with the quality of the sperm or semen is normal sperm concentration. That is how much percentage of sperms are normal in structure. Each sperm has a head, neck, body and tail, because these good sperms are the one which is going to make pregnancy. So at least 4% of the sperms should be normal. So now we look at what are the common reasons or lifestyle changes or lifestyle disorders, issues which can make quality of your sperm very low. One is smoking and alcohol. These are the two very common addictions. It can change the testosterone concentration. It can change the DNA fragmentation. DNA fragmentation is something which makes the sperm of very poor quality. So you have to stop the smoking and alcohol at the as early as possible. Still, it takes some time to recover the sperm quality. Next point is heat exposure. If you are using tight underwears, tight jeans and keeping laptop on your lap or using sauna, steam and so very commonly, this can increase the temperature in the scrotum. That is, scrotum is the sac where the testes are situated. So that will increase the temperature in that scrotum. It can reduce the sperm quality. Basically, it will reduce the motility of the sperms. Are you not sleeping very enough? Are you not monitoring your sleep properly? At least 6 hours of good sleep is very much essential for maintenance of all the hormone systems in our body. So good sleep is very much essential. And the most killer of any infertility issue is like a stress. So if there is a chronic stress, that again will affect the hormones and it can affect the sperm production in turn. So you have to get rid of your stress before starting any infertility treatment. Are you taking any medicines which can affect the sperm quality? There are a lot of medicine. It can affect your erection, it can affect your the ejaculation, and it can in turn affect the chance of pregnancy. So you have to take care of all these things, the lifestyle changes. And the fifth one that comes is the obesity. If your body weight is very high, that is more than 25 BMI or something, that will reduce the testosterone and it can reduce the sperm count, motility and morphology. So before taking any treatment or along with the treatment, you have to take care of all these lifestyle changes. You have to get rid of smoking, you have to do good sleeping, you have to get rid of overheat exposure, you have to do good exercise, you have to take good food. What does it mean by good food? You have to avoid all junk food. You have to avoid all carbohydrates, high carbohydrate diets. You have to avoid all bakery items, all sweet items. These things will increase the carbohydrates in your body that can in turn affect the metabolism in the liver and the hormone production. So that will cause a very poor sperm quality. So this lifestyle modification is very much essential before starting any treatment, or if you are taking any treatment, you have to take care of these things along with the treatment, then only you will get a good results. So male infertility, there can be either no sperms, that is called azoospermia, or there can be a decrease in the sperm count. Sperm count can be decreased in mild, moderate and severe. So when there are no sperms, there is severe decrease of the spermatozoa, that is very poor sperm count, poor motility, zero motility, or very poor sperms, quality sperms. Then the ideal thing is to go for IVF or ICSI. So these are in ICSI, we select the best sperm morphologically, and we do sperm selection method, and to take the best sperm, and we'll inject that sperm into an egg which is taken from your wife's ovaries. So this will be fertilized, this egg will be fertilized with the selected sperm from your husband, and we create embryos. These embryos will be transferred into the uterus. That means even if you have a zero sperm count, we can take, in most of the cases, we can take sperms by small needle procedures from your testes, and that can be used for the IVF treatment. But if the sperm count is affected very little bit of affected, or the sperm count is just below normal, lifestyle changes plus little bit of medicines can be useful. And if that also is not working out, there are some simple treatments where IUI means the processed washed sperm that will be injected into the uterus during the time of ovulation, and that is called intrauterine insemination. That also can give pregnancy rate much better than the natural intercourse. So to conclude, yes, low sperm count doesn't mean that you cannot be a father. You still can be a father with the proper lifestyle updations, lifestyle controls, and good habits and good treatments, proper timely treatment. If your wife age is more than 35, you should not wait for 1 year. Within 6 months you have to take treatment, and if your wife age is more than 40, then you have to take treatment immediately. Do you think the age will not affect the male? Yes, it can affect male also. If the age advances, the DNA fragmentation in the sperms can increase. That can affect the chances of advanced IVF treatments. And at Birla Fertility, we start the treatment, or we start the entire things as soon as the patient comes. We start with a very simple semen analysis that can tell a lot about you, and that is very important to start with the advisors, counseling. We are not going to jump to IVF treatment or anything right in the beginning, but we will guide you properly with regard to what are the results, how it has to be interpreted, what lifestyle modifications can be changed, how a pregnancy can be achieved in a simple way. And that is very important at Birla Fertility and IVF. We just give more importance for an ethical, transparent treatment. Thank you.